In the fall of 2021, a chill settled over the offices of numerous New York physicians. It wasn't the approaching winter, but a letter from New York Attorney General Letitia James. This wasn't a friendly hello, it was a stark warning. The letter targeted doctors prescribing ivermectin to treat COVID-19. James, citing FDA guidelines, deemed the drug unproven and potentially dangerous for this purpose. She went further, stating that any doctor prescribing ivermectin for COVID-19 risked investigation and possible prosecution. This letter, though seemingly aimed at a small group, sent ripples of unease throughout the medical community. It raised a fundamental question: who ultimately decides how a doctor treats their patients? The letter ignited a debate, not just about the efficacy of ivermectin, but about the very nature of medical freedom in the age of COVID-19. The stage was set for a legal showdown. Doctors, feeling their autonomy threatened and convinced of ivermectin's potential, were not going down without a fight. The letter, intended to stifle dissent, had instead sparked a resistance. This resistance would soon take the form of a federal lawsuit, pitting frontline physicians against the full weight of the U.S. government's health apparatus. Ivermectin, a medication primarily known for treating parasitic infections, became an unlikely flashpoint in the COVID-19 pandemic. Its journey from anti-parasitic to potential antiviral began with in vitro studies. These lab experiments suggested ivermectin might inhibit the replication of the SARS-CoV-2 virus. Early observational studies, some conducted in countries grappling with limited access to expensive COVID-19 treatments, hinted at potential benefits. However, the U.S. Food and Drug Administration remained unconvinced. The agency pointed to the lack of large-scale, randomized controlled trials to definitively prove ivermectin's efficacy against COVID-19. They cautioned against its use, highlighting potential side effects and emphasizing the importance of relying on FDA-approved treatments. Despite the FDA's stance, a growing number of doctors, particularly those treating COVID-19 patients directly, began incorporating ivermectin into their treatment protocols. They cited anecdotal evidence of its effectiveness in reducing viral load and preventing severe illness. These physicians argued that in the face of a novel and deadly virus, existing treatments like ivermectin should be considered, especially when the potential benefits outweighed the risks. The stage was set for a clash of perspectives: the cautious regulatory approach of the FDA versus the real-world experiences of frontline physicians. The threatening letter from Attorney General James proved to be a catalyst. A group of New York doctors, already frustrated by what they perceived as government overreach in dictating treatment protocols, decided to fight back. They filed a federal lawsuit against the U.S. Department of Health and Human Services and the FDA. Their claim the agencies had overstepped their authority by actively discouraging the off-label use of ivermectin for COVID-19. The lawsuit argued that while the FDA has the power to approve or reject new drugs, it cannot dictate how physicians prescribe existing FDA-approved medications for uses not explicitly covered by the initial approval. This practice, known as off-label prescribing, is both legal and commonplace in medicine. The doctors contended that the FDA's campaign against ivermectin for COVID-19, including public statements and warnings, amounted to an unprecedented intrusion into the patient-doctor relationship. This lawsuit wasn't just about ivermectin, it was about a fundamental principle of medical practice. The doctors were fighting for the freedom to make treatment decisions based on their clinical judgment and the individual needs of their patients, not government directives. Their case raised a critical question. In the midst of a public health emergency, how do we balance the need for scientific rigor with the right of physicians to exercise their professional judgment? The outcome of this case has the potential to reshape the future landscape of medical practice in the United States. Let's all keep a close eye on developments to come. Thank you for watching till the end. Stand up for free speech and help protect the free exchange of ideas online. Please like and subscribe to help us reach more viewers.